Hello, my name is Tony Blakeslee. I'm head of the Population Interventions Unit, Melbourne School of Population and Global Health, University of Melbourne. And I also lead this thing, Scalable Health Intervention Evaluation, what we call SHINE. And that's what I'm about to talk to you about today. And we're now open for business and collaboration. So I mentioned that there was research that could rapidly and comparably answer questions of this type. What is the health gain or health system cost or productivity impact or cost effectiveness of any intervention X over the population's lifetime, or maybe just the next 5 years, by strata of sex and age, by ethnic group or socioeconomic group to look at inequalities, compared to business as usual or another intervention Y or range of interventions. Well, that's what SHINE's achieving at the moment. We are realizing that vision, and reactions of policymakers we've spoken to about this include that this is the holy grail. Not to technocratically determine policy going forward, but to have a solid basis of information to start that discussion at the decision-making table, and to integrate the epidemiology and economics with data science, i.e. take this mode of operating to this century. So how does SHINE work? Well, basically, we bring in a lot of epidemiological data from the global burden of disease through pipelines. We have data from the Australian Institute of Health and Welfare. We bring in data on when you've got a disease, how much it's going to cost the health system, how much income you lose. So bingo, you can get productivity cost impacts of interventions, i.e. productivity gains, hopefully. Intervention data, what is the effect size of reducing cold housing on respiratory disease? Or what is the effect size of masks on transmission? Then we convert that all through with a large software program or modeling framework into health adjusted life years, same as qualities, into net health expenditure, both the cost upfront of an intervention and the downstream cost of changing the flow through the health systems by changing disease rates. Income gains, what is that productivity gain from an intervention, particularly if it hits diabetes or obesity, it's large. And the morbidity and mortality rate impacts. And we produce 3 types of outputs, those for academic audiences and with academic collaborators, for consultancy services and tools, which I'll speak about in a sec. And all of this is aiming to improve health, reduce health inequalities, also look at interventions stratified by patient characteristics like absolute CVD risk, cost savings, cost effectiveness, and increased productivity. So just 2 examples of tools we have. First one is the Australian New Zealand Health Intervention League Table, or ANZ Health, hopefully soon Global Health. This is a cartoon from the Lorax. What everyone needs is a need. Well, I think everybody needs a league table. And here you can just see some examples of interventions. Don't worry too much about details, but what you don't normally see in a cost effectiveness evaluation is how big that impacts. It could be huge for taking the tobacco out of a country versus quite small for an app that helps people do physical activity. The next tool that we're developing at the moment, it's nearly up, is the Health Intervention Impact Calculator. 2 versions. First version is where you come along and say, well, I've been told about this intervention, or I'm studying this intervention, and it's going to reduce, we think, colorectal cancer incidence rate by 5% for 54 to 74-year-olds. Now, what impact would that have in the future on health adjusted life years and onto health expenditure? This tool will allow you to do that. And it's a tool for researchers so that they can understand what their intervention is going to do and use that type of information in research grant applications and interpreting the results. It's also a tool for policymakers when they're getting many proposals put at them, and they can say, gosh, what is the relative health impact of these different types of interventions if you can convert that into disease rate changes? Mark 2 of the Health Intervention Impact Calculator will be the same type of idea, but where rather than changing disease rates, you change risk factors like glucose or tobacco or BMI and see what impact that would have through, not just at one point in time, but over time into the future. How can SHINE help you? Well, just on some tools, but consultancy services. So we are open for business. For examples of recent policy work we've done, go to our website and look at the work we did for New Zealand's extraordinary tobacco endgame, where they're going to denicotinize, reduce retail by 95%, tobacco-free generation. Quite extraordinary. We were commissioned to do that work. Go and look at our website, pandemictradeoffs.com, for a whole lot of research we've done, and a large tranche just been released in the middle of 2022 on various policy options, vaccines, masks, suppression strategies for how we can manage this pandemic in the next 18 months. Future clients could include government and state, federal. And you can think of many examples here, but for example, what interventions would actually close the Aboriginal and Torres Strait Islander health gap? What interventions would achieve the targets in the very good Australian National Prevention Strategy? NGOs, national, international level, what might be the effect of a tobacco endgame going across several countries? Philippines, Australia, Canada. And then in the health services, we're developing infrastructure at the moment that allows us to look at interventions and investigations in health services and how they might play out by differences in people's comorbidity and in their, say, 5-year risk of cardiovascular disease. So on an academic level, this is not just for policymakers, also for researchers. In the same way that you can think of a biostatistical service as supporting a research program, what we do can also support other researchers in thinking about, how do I explain the significance of this intervention I want to study for the significance in my research application? But also at the back end of your research, now that I've done the research, what effect might it have on population health and health expenditure? Type of information that goes that extra step in the discussion to make your results more impactful and policy relevant. And we're also collaborating with researchers, just one example, Healthy Housing, trying to work out the total envelope of health gain and health expenditure savings for interventions on cold, mold, indoor air quality, heat, all those types of things to try and describe that total area for addressing one determinant of health. So that's a brief overview. For more, please go and see our website. Just Google Shine Blakely, you'll soon find it. You can contact us at this email address here, and we've got a large team of people keen to work with you and to assist you in whatever your endeavour is. Thank you.